broadcasting live at OB-GYN, and welcome to the YouTube channel, OB-GYN Chats, where we chat about things that affect your health. And having the experts in studio for today, we're joined by Dr. Simon Mbula. Welcome. Thank you.
Hi, Olka. How are you?
Very well.
Thank you.
It's a brand new year. It's
Yeah.
now the month of February.
Yeah, it's a month of love.
Yes, it is. Where's your red?
Oh!
You have the pink. That qualifies.
Exactly. The pink is braiding in.
All right, so broadcasting our first edition on the YouTube channel with OB-GYN Chats. Today, it's all about the danger signs in pregnancy. So let's take it way back on the drawing board. When a woman expects her first child or second or third, what are the normal signs of pregnancy? And let's go into the danger signs and how we can pick that up in 3 different phases.
You know, pregnancy is quite a precious moment for every mother. And I mean, those 9 months that a mother goes through, it's quite an interesting journey, and there are a lot of changes that happen. And every pregnancy is unique, you know, and as much as we have those universal symptoms and signs that all the pregnant mother experience, there's also some danger signs that one should look out for. You know, it's commonly the first trimester, most women, they'll tell you about the morning sickness, the famous morning sickness, which is actually, they'll say, no, I'm feeling a bit dizzy, I'm nauseous, I'm sensitive to smells, and all those. Those usually, they're normal, and they happen in the first trimester, and actually it should resolve in the second trimester. So pregnancy being divided in the 3 trimester, where you have your first, your second, and your third, which we say the third trimester is the advanced stage of the pregnancy. So there are quite a lot of danger signs that a woman should look out for. And I mean, like in irrespective of whatever semester, one that I always like tell about my patient is that the moment you see blood in pregnancy, that's a danger sign. That's one of the most common ones, irrespective of the first trimester, second trimester, third trimester. When there is blood on the pad, pregnancy, ideally, we were not supposed to see any blood. It's a danger sign that you must go to the hospital, go to your doctor, or pick up the phone and call your doctor. That's one of the most common ones. But I mean, I'm going to divide them as we go according to semesters. Then I think it will be more easier for listeners to understand and comprehend.
Sure. So that's number one of the major signs. So now let's unpack it to the second and the third. So the second, what would we be looking out for?
So so going back, so whenever there is, like I mentioned, with bleeding, so if it starts in the first, you expect that it's either it's a miscarriage, or it's a threatened miscarriage, or it's an ectopic pregnancy, which is obviously a life-threatening condition, or sometime in the first trimester they get what we call implantation bleed, which eventually it shouldn't be a heavy bleeding, but irrespective of the amount of blood, which is one should search help. So apart from the bleeding, so if it comes in the second trimester, it might be that a patient is still going through a miscarriage, those what we call mid-semester miscarriages. Those are pregnancy losses that happen in more advanced, that means after 13 weeks. And ideally in the third trimester, it means that or between the second and third trimester, either the placenta, which is feeding the baby. Remember, when the baby is in the sac, it's being fed by the placenta through the umbilical cord. So sometimes when that placenta lies close to the opening of the womb, they have a condition which we call placenta previa, and that can be one of the cause of bleeding. Or sometimes this placenta, which is feeding the mother, it detach. If it detach from the wall of the uterus, it can also cause bleeding, and which is a very life-threatening condition. And again, if there's bleeding, can also be a sign of just early labor, that they are getting either in preterm labor, or they are actually getting into labor. So bleeding, according to semester, it's a danger sign, and ideally they should seek medical care. I mean, another one, because we'll go according, the most common one that we are always tell my patients, once you see this, if there is any water or rupture of membrane.
So that's not the water burst like in the movies we see. That's something else.
Yeah, it's the same, but the water burst usually happen the normal water burst happen in the third trimester, the term pregnancy, as a sign of labor.
So if it's before, then
if it's before, then it's a danger sign. So before term, if there's water bursting in pregnancy, irrespective of the gestation age, it's a danger sign, and the mother should go to the hospital or should call their doctor. So that's also, because the thing, what we worry about here is that if there's a water burst and the mother is not in labor, the cord can come out. So the umbilical cord can come out and can cause a cord prolapse, and eventually, which is very life-threatening to a baby. And also, if his mother stays at home with membranes which are ruptured, it's an opening for infections to go up. So all those risk associated with bad outcome for the mother and for the baby.
So when any of this happens, number one, you said you should call your doctor, your
Yes,
GP, your
definitely.
gynecologist.
Yes.
And when they come to you, what is the process from there? What would you, as a gynecologist, now do from there? And where does it come between terminating a pregnancy if it comes to that level, or what's the procedure from there on?
I mean, when it goes to that, it's always you assess. I mean, every patient that we see, you assess them individually, because and unfortunately, like in medicine, every patient present differently. So depend on the gestation age when it happened. Then we kind of counsel and treat the patient appropriately. If it's in a term pregnancy, then we manage if we are going to keep them in the hospital, progress with pregnancy. But if it's a peri-viable pregnancy, which means or pre-viable, that it's more pointing to a miscarriage, then eventually that's when the intervention comes in. But after counseling and speaking to the mother regarding the outcome and the condition that they are going through. But I mean, the danger signs, there are quite a lot, and we can and I mean, we'll unpack it as we go, because we have to list a lot of them.
A lot. All right.
Yes. Yeah.
So with a woman, we always say at OB-GYN, prevention is better than cure.
Yes.
So before the bleeding happens, or maybe the water comes prematurely, are there ways that a woman that's watching right now to avoid those circumstances? How can we better take care of ourselves?
Yeah. Some of the things, I mean, like there are things that we can prevent, and there are those that we can't prevent. And I'm going just to go back and just list other danger signs, and eventually I'll unpack on what we can do. One, like if there is pain in labor, because as much as we keep saying eventually a pregnant woman will have a bit of pain, but whenever there's that consistent pain, especially when it comes from back that comes and go, it might be contractions. That is a risk factor for people. So if there's a pain which is the mother is not, because a woman knows her body. As much as the pregnancy has been going on, you know that I have been getting a bit of some pain, but now today it's quite a lot. Extreme, or it's quite persistent. This pain is not going away. Pain in pregnancy is also a sign of, it's a danger sign. It needs to be assessed by a clinician and let them reassure you that, okay, there's nothing, it's just maybe one of those pain of pregnancy that eventually to go away. That's one of them. The other thing that one of the danger signs that I actually I think I should address is it's a reduced fetal movement.
Okay.
Yeah, because when a pregnancy advances, ideally from 16 weeks or between 16 and 24 weeks, the mother should be able to start feeling the baby move. And every pregnant mother knows the pattern of the movement of the baby. So you kind of know today. This is unusual. So whenever a mother pick up reduced fetal movement, then it means there's a need to go to the hospital or to your doctor's office so that the baby can be assessed. And there are multiple ways to assess a baby. Doing an ultrasound, checking the fetal heart with a CTG machine. So if there is reduced fetal movement, a mother should go to the hospital. Because in most cases, what a mother would do is like, let me wait, maybe tomorrow the baby will move. Unfortunately, with a pregnancy, it's an unknown, because even for us clinicians, we are treating someone who is in the uterus. We are treating them via treating the mother. So which means we also struggle to pick up some things during pregnancy. So ideally, if there is reduced fetal movement, irrespective of the time of the day, irrespective of where you are, ideally, a patient must go and seek medical care. Let them get reassurance from the hospital that the baby is fine.
And that's where they get the sonars to check.
Yes, and if you go back home and you still feel like I came from the hospital, but I feel like the baby is still not moving well, just go back.
Okay, double check.
Just go back, because there's nothing that beats a mother's instinct. Because you know exactly, you can feel when your baby is not well.
No, you're right.
So the mother's instinct is always there. Even if you rather come, be that person who irritates us. It's okay. It's part of it. I mean, that's why we are here. If you feel like, no, but I have been there already, now I'm going back, it's okay. Rather be safe and just irritate us. And it's not an irritation. We might come back and say, oh, but you were here yesterday. But it's okay. At least we know that we have a healthy and a mother and a healthy baby.
Better safe than sorry.
Yes.
So wrapping up, Doc, again with the lifestyle, what are the things to like you said, some things you can't avoid. It will naturally happen. But what are some of those things that an expectant mom can be on the lookout for? It could be the eating, the exercise, to make sure that she avoids, these danger symptoms.
Yeah, so when it comes to pregnancy, lifestyle modification, we don't expect a woman to change their life pattern. I mean, the pattern of activities they were doing. Because, like, ideally, if a patient used to exercise before pregnancy, continue exercising. Obviously, in conjunction with what your medical practitioner is advising, which one is safer, which one is not safer. Dieting, we don't advise for diet in pregnancy. Usually, what you used to eat, continue with, because you can now reduce your intake. But ideally, there are also those risk factors that we look at. If someone have a high blood pressure, they have diabetes, they become more high risk. Which anything that deviates from the normal in pregnancy, if there's a bit of pain, means you must seek medical care. It's okay.
Yeah.
If there is pain when you pee, it's still a danger sign because it can be a risk for preterm labor. You must seek your medical care. If by any chance there's this persistent headache, because you get a headache and it's just quite severe, you take Panadol, it's still there. Still seek medical care, because one of the cause of headache in pregnancy commonly is high blood pressure. And high blood pressure, we know, especially pre-eclampsia with a pregnancy-induced hypertension, is one that it's the number one killer of our mothers here in Namibia, in Southern Africa. So whenever there's persistent headache, let a doctor have a look at it. Have a look at you and assess. And the other thing is, one thing which I forgot to mention is edema, because we know that we associate pregnancy with swelling up. That the mother usually, the feet swell up, Is
that normal, or is that a danger sign?
It can be normal. It can. There's a normal.
Because time and again, I had some swollen up feet.
Exactly. There's
and that was normal.
Yeah.
So how do I tell the difference between normal and not?
There's abrupt edema, abrupt swelling up, where you were literally just fine, but you can see that from yesterday, from the past 2 days, you can't fit in your shoes. Your fingers, you can't fit in your rings.
Okay.
Literally, you are swelling up, and you can see even in the mirror. So that's a sign that there might be, because there is a retention of fluid, maybe there is an elevated blood pressure. Because one of the signs of high blood pressure in pregnancy or preeclampsia is edema. So it's edema that is progressive rapidly. It's a danger sign. So one should look out for that. And also, if there is this pain, especially pain around the upper area, we call it the stomach. Then most patients will say, no, I have a gastritis. That pain, that common gastritis in pregnancy. In most cases, that pain around that area is also associated with high blood pressure. So whenever there's that pain around the tummy that we are not so sure of, you keep taking some anti-acid, and you take the common antiacid that people like taking, the Gaviscon. You take Gaviscon because you have sometimes it's because there is actually a problem with your liver because of high blood pressure. So always, all these uncertain symptoms, uncertain pain, uncertain movement, you rather have a healthcare practitioner have to assess you and at least reassure you that everything is fine than staying at home.
Great stuff. Doc, thank you so much. We appreciate your advice.
Yes.
Always the experts in the industry to help our moms, be it the first-time mom or the fifth-time mom. You never know. Thank you so much, Dr. Simon. Any final remarks?
So to conclude, danger signs are quite a lot. And like I spoke as we started this conversation, that every pregnancy is unique. There's nothing like, I'm an expert, I have been here before, so I know how to deal with this pregnancy. In pregnancy, there's a lot of changes that happen, and every pregnancy is unique. So whenever there's something out of the ordinary, be it pain, it's movement, it's swelling up, it's headache, it's pain on urination, bleeding. So all these signs, we shouldn't ignore them, and rather have a clinician assess the patient or assess the mother, be it or via the phone call, be it on a physical visit, but at least to get reassured and making sure that we avoid poor outcome of pregnancy.
Very well said. Dr. Simon, thank you very much. And one of the next episodes will be about pre-eclampsia as well.
Yes.
Thank you so much.
No, thanks a lot.
There you have it, Dr. Simon. So every once a month, we give you OB-GYN chats. Remember, drop your comment, your post, your opinion on the timeline at the bottom, and we'll be sure to answer that for the next month's edition. Until next time, thank you, Doc.
Thank you.
Cheers to you.
No, cheers to us.
Cheers to us and you.